There's like a super delay happening.
I feel like I'm looking at like three of myself right now. It's uncomfortable. Really uncomfortable.
You're in
I'm
three
not
dimensions.
not liking any of this right now.
Okay, so Anjali said she could hear us. So why don't we just start? Because it seems like it's working.
I just feel bad that I might not see the questions. So that's what's
I
going on.
I could keep an eye on that.
Okay. Sounds good. So ladies and gentlemen, if you have a question at at any time, you can type it up. The sooner the better, probably, so that we have a good chance of seeing it. If we don't address it by the end of it, that means that we did not see it, and then we can maybe do a follow-up message or something. Okay. So here we go. Our official start. Hello, everybody.
Hi, everyone. Sorry for the delay.
Sorry for the confusion on everything. Let me just get back to where I am. Okay. So my name is Vanessa Meyer, and I'm a Vanessa M. Meyer LLC. I'm sure you know me, and if you don't, welcome. I'm an intuitive healer, background in massage therapy, yoga, fitness, and a bunch of other stuff. But that's not why we're here tonight. We're here tonight to introduce you to my amazing, intelligent, and beautiful friend, Dr. Natalia Pellegrino. She's a naturopath, and we're doing a live Q&A. We're trying so hard, as you can see, to make it.
We're doing our best.
Doing our best. And we're here to talk about all things naturopathic, medicine, and wellness. Dr. Pellegrino will answer your pressing questions about natural health and why everyone needs a naturopathic doctor on their wellness team. We'll also be talking about Dr. Pellegrino's upcoming course, which will guide you through the foundational steps to healthy hormones. She uses this with all of her patients. Welcome, Natalia Pellegrino, doctor. Sorry.
Hi, everyone. Thanks for having me. I'm excited to be here and hang out with all of you.
We're very excited to have you. So before we dive into the Q&A, a little bit of background on our doctor, and I will try to speak clearly and slowly. Dr. Natalia Pellegrino, she's a naturopathic doctor currently practicing in St. Paul, Minnesota. She has been working in the field of holistic health since 2006, and that's how we met at New York College of Health Professions. First practicing as a licensed massage therapist for 10 years before becoming an ND, Dr. Pellegrino sees adults and treats a variety of different health conditions with a primary focus on helping women optimize their hormones using the most natural means possible. She does in-depth lab testing and hormonal analysis to develop customized health plans for her patients, including nutrition, herbal medicine, targeted supplements, and lifestyle modification to help her patients achieve optimal health. If you thought that was a lot, wait till you hear what else she does. Now, without further ado, get to it. Just you wait. Well, let's go with the most obvious question. What is a naturopathic doctor?
I'm so glad you asked. I think that's a good place to start because I get this question all the time. A lot of people are just like, I've never heard of that. And it makes sense because we're a pretty small profession, but we're definitely growing in numbers. And naturopathic doctors have actually been around and licensed practicing medicine in the US since 1919. The first naturopathic school was actually opened in New York City in 1902. So we've been around for a while, but our focus on natural remedies and prevention became sort of overshadowed with the development of modern diagnostic procedures and treatments, including things like medications, antibiotics, for example. So that sort of took over. But we're an old profession. We're starting to become a lot more mainstream since the patient as the consumer is seeking out more information on natural remedies, and they want the best healthcare options for themselves and their families. So to give a little bit of background on my training, NDs undergo the same 4-year postgraduate medical training as MDs and DOs, but we have the additional training in evidence-based natural medicine. So having an ND on your healthcare team is kind of like getting the best of both worlds for your healthcare, rather than focusing more on symptoms and using Band-Aid treatments. I work to identify the root cause of illness and then customized plans to my patients, helping them have a more personalized approach to their wellness using the most natural means possible whenever we can. So another way I like to describe it is that I'm basically like your medical detective. So I'm a super nerd with everything natural medicine. I do a lot of research and reading, and I'm always looking at the best options for you and your health. And we'll just basically keep working together until we figure out what that root cause is. So I basically don't give up, and we continue to seek answers until we find out what's going on.
I love that response, and that not just the educational part of it, but just saying that you don't give up, because I feel like there's been many cases, even my clients, that have turned to me as like a last ditch effort sometimes when they don't believe in holistic stuff or don't really understand it. And that's not really how it works. We're all complementary and we're supposed to work together, right? And should definitely not be the last ditch effort. We want to make sure that we're also being preventative in our healthcare as well. So this is a big change in thinking, I think, for some people, being preventive. Yeah. So, Dr. Pellegrino, I mean, if I have a primary, why would I need to seek out a naturopathic doctor? I just don't understand.
Yeah, so in an ideal world, and I think I went into naturopathic education with this hope as well for the medical system and my future patients, that ideally everyone would come and see me to prevent future illness, to optimize health, and all of society would be super healthy. So this is my vision of what the medical system could be, and I think it will be at some point in the future, but unfortunately, the current medical system, at least in the US, is not set up for prevention. So most people think about, I'm not feeling well, I'm having symptoms, I'm going to go in and see my doctor. And they're not thinking like about prevention or preventing those things before they pop up. And I don't think it's anyone's fault. It's just sort of like, how we're trained to see going to the doctor, basically. So at most, people might go in for an annual physical, get their basic labs, which is better than nothing for sure. But I do see a small number of people who are already super healthy and wanting to maintain their health. But again, most often people will seek me out when they're having symptoms. Typically, it's someone who's just not feeling well. They know something is off. Often people, like you said, have already seen multiple providers. Maybe they've seen some specialists and they've been told everything's normal. So, or you're just getting old. And I've actually been told that by a dermatologist that I saw, which is just so disheartening. And it's just not the truth because, there's always more seeking that you can do. So, and then the patient is sent on their way with some sort of medication or suppressive treatment only to have their symptoms persist. So that's why I think most people would seek me out, is because they're just looking for more answers. They're very educated, they've done their own research, and they know that there's a better way. So, and we'll talk more later about, like, should you still have a primary? Because I'm not like anti people having a primary care provider, but yeah, we'll get to that later.
I think you're right with just with saying that there's always these old adages that we tend to hear a lot of, oh, you're getting old, or it's this or whatever. And it's such a cop-out in a sense, right? And it's really sad because then people just leave thinking that, well, this is just what happens and this is how I'm going to feel, or I'm not going to get better. And there's obviously things that follow with that, like depression and anxiety. And so it's really important that people understand that, you don't just take the first response, and like, if you're feeling like there should be more of an answer, then you're probably right? Because we know ourselves better than the doctor does. So what you've been experiencing, and nobody should be downplaying it, and you should always look for more. So I'm glad you addressed that. Thank you.
Definitely. You're your own best healer.
Yeah. Right. So can you tell everybody, what are some of the specific symptoms people come in with? What do you normally see?
Yeah, so I think that's good to talk about because it gives you an idea of like, maybe some things that you're experiencing yourself, and like, why would you sort of seek out more information. But most often my patients will come in with kind of vague symptoms of I'm just not feeling well. And it's been kind of like building up over time. So it's cumulative and it's really crept up over the years. And then they just realize that they don't feel as good as they did 5 years ago, for example, and maybe feeling pretty tired, lack of focus, mood issues, sleep and digestion are off. And you're just having more and more symptoms popping up. Some other common ones would be really inflamed skin. So I see a lot of people with acne, rosacea, eczema. I talk to many, many women with period issues, difficulty getting pregnant, and other general symptoms. So like allergies, headaches, and a lot more. And what I find is there's usually a tipping point where there's a lot of different symptoms, and it's enough to get someone on Google or talking to friends and family. Then they start searching for options. They learn about naturopathic doctors and they breathe a sigh of relief because it's like, you know, I can look into this deeper and I have someone who's going to work with me to help me more. And so the reason that people seek me out really varies quite a bit. But ultimately they're just seeking more answers to why their symptoms came up in the first place and why they haven't gotten better with conventional treatments.
Yeah, I mean, I think it's important too. I mean, you mentioned one that's always affected me is eczema, and something as common as that, right? You know, I don't think I had proper care of that for a long time or knew what it was until we went to New York College and understood about the stress levels and allergies and things like that, and how a lot of it is dietary and stress related, you know? And it's fascinating to me that people still treat it like solely topically. So coming to somebody like you that knows, you know, more in depth about those things, it's just so important. And I'm just glad people can have alternative or complementary ways, I should say, of taking care of themselves and getting education on it.
Yeah, me too.
So all right, so now somebody's finally made that jump and figured out that, you know what, I need some more help. I need some more answers. So they set up an appointment with you and now they're getting a little anxious. What's going to happen during this appointment?
No reason to be anxious. It's going to be so different from your visit with your primary care, where there's a lot of nervousness, and it's okay to be nervous. But I think once we start talking, I'll put your mind at ease. And it's really it's a different type of medical visit than most people are used to. So the initial visit is about 90 minutes typically. And beforehand, I would have you fill out a pretty extensive intake form. So I just get an idea of like some of those patterns that have built up over the years and like exactly what you're going through health-wise.
Yeah.
And then during the visit, we'll just go through that entire health history in detail and your current symptoms. And I want to know a lot about just those basic lifestyle foundations like diet, general lifestyle, sleep, digestion, stress levels, and also things like history of medication use, because, you know, the cumulative effects of those can be significant, like especially antibiotics and hormonal birth control. So I see quite a few people who, you know, maybe were put on birth control at age 13 and are now in their 30s and wanting to have a family, and they've just don't know what their hormones are doing that whole time. So it's a lot of education and just getting to know you. Also asking a lot of questions about the home and work environment and other factors that can really affect your overall health. So another thing that I've gotten really interested in recent years, because we had a mold issue at one of the offices I was working in. And, you know, not everyone is affected by mold the same way, but we had some water damage to the building and some people had really significant symptoms. And like when that exposure lasts, sometimes even when you're out of that environment, I want to know, like, have you been in a moldy environment? Because that's pretty significant. And then during that visit, we'll give you the basics. I'll kind of give you the foundation on like what a healthy lifestyle looks like. So how can we start bringing in more good things and reducing some of the less great things that you're doing in terms of habits. So good nutrition, water, regular movement, stress reduction, mindfulness, sleep, and a lot more. So I'm kind of like touching on all of those things in each follow-up. So every time we're checking in, I'm kind of like keeping you accountable for making some of these changes. And I really like the idea of just making gradual changes, because I think, you know, some people get in and they're really excited to like do everything. And I just want to have like a total overhaul, but then you get overwhelmed and it's not sustainable. So ultimately we want small gradual changes that stick. So I'm a big fan of like figuring out like what those things are that are going to work for you and what you're going to be able to maintain so that it does become more of a lifestyle. So I'm not about quick fix ideas. And just really empowering you to be your own healer, as I mentioned before. So just when you really start listening to your body and the signals that you're getting about your health, it becomes a really intuitive process.
Yeah.
And then in that initial visit, I'll also recommend more in-depth labs. So we just have more data and we're not guessing. And I do a lot of conventional type tests like blood tests, thyroid, iron, cholesterol, and, you know, what you would assume are just basic labs, but then we'll go a little more in depth and maybe do some more comprehensive panels. And then things like digestive health testing and hormonal testing. And then we would just basically keep meeting until you're feeling amazing and you don't need me anymore.
And that they're all educated and they can
Yeah, and you're just
their own, right?
so much better.
I also just want to remark too, when she's talking about the lab testing, you know, this is not your normal routine blood work panel. So particularly with thyroid stuff, people get these just little markers and then the doctor says, you're within normal range and everything's fine and it's great. But they're not doing a full thyroid panel generally. And you usually have to ask, which you, by the way, you can ask your doctor to do more. You just have to know what to ask. And most people don't know what to ask. So it's quite a different experience. It's way more in depth. And if it sounds a little overwhelming, even as the doctor's talking, there's a reason, because it's so in depth. And someone like her is just not going to stop with, oh, well, this looks okay. So let's just move on. It's fine. Meanwhile, feeling all exhausted and fatigued and, you know, can't lose a pound or can't gain a pound or whatever it is.
Yeah, and your hair's falling out.
Right, your hair's falling out.
But you're fine.
Fine. Don't worry about it. Or I usually, actually, I remember the first time I went, I heard, but you're a new mom or you have two little young kids or whatever. I think it was actually with Bella. So he looked at her and said, you're just tired. You're exhausted. Of course you're feeling like this. And I'm like, you're right. And you're really wrong. So that's unfortunately one of the things you'll hear a lot. Oh, you're just a tired mom. That's just how it is. Being a mom. You know, and I'm sure it goes with dads too. Oh, you have hair loss because it's in your genes and that's it. And it has nothing to do with stress, right? Or your eating habits or anything like that. It's just one thing and that's all it is.
Yeah, and thanks for bringing that up, because I think that's so important too. And like, I do advocate for my patients to like, maybe they do go see their primary because they want these labs covered by insurance, which I was going to talk more about later, but you know, knowing what to ask for. So Vanessa knows, like, she's educated and has done a lot of her own research, and we've talked about these things, and she knows what to ask for. So, and a lot of times if you ask, they will be willing if you rationalize it with like, I just want more information. So like, how can they say no to that?
Right, exactly. And we had a question about insurance, which Sheena will get to in a little bit. Because I know, especially after hearing all this, the difference of care, it's like, please let this be covered.
Yeah, please. Yeah, well, I'll get into that a little bit more in a bit.
Okay.
It's a good question.
Yeah, it's a really good question. So how long will someone typically need to work with you? And you kind of did answer this at the last part.
Yeah, so in general, I like to use the general rule of thumb that, let's say you've had symptoms for 5 years. it's going to take about at least 5 months of more focused care. So like 1 month for every year that you've been feeling off, because again, this is a process. It's not a quick fix style of medicine. Our goal is to resolve the symptoms. So it is going to take some time. And so that's, more concentrated treatment, like working on digestive health in a more focused way. For example, working on your diet, reducing stress, which is going to affect the gut. And we didn't become unhealthy overnight. So it's going to take some time and dedication. And you're basically investing that time in yourself and your future, health. So, but just to give you a general time frame, it really varies so much depending on what's going on. But most people will follow up a little bit more in the beginning. And then, we're just doing more work, more lab testing. So it's a little bit more front loaded. And then as you sort of like get used to some of the lifestyle things and you're making these changes and you're, sustaining them, then we kind of like take the training wheels off and you're like, I could do this on my own. And maybe we just check in every year, or if something goes out of balance, we check in again. And like, often people will come in for one thing and we sort of like work through that and they're feeling better. And then we kind of like start chipping away at something else. And they're like, hey, do you do this? And so I work with so many different health conditions that ends up happening a lot. Okay. So the timeline just really varies, I would say. But ultimately, like I said, I don't want anyone like just having to come and see me forever, because ultimately we want those symptoms to resolve. But I do love to see people like regularly. And a lot of times people just enjoy, we build a relationship. So they enjoy checking in and, they just really love optimizing their health. And we just continue meeting every few months.
Yeah, of course. And I think, with a naturopathic doctor, it's important to know that like check-ins are really, really vital too, right? So we're not just going in for, the physical that's not really complete. We want to make sure that everything's really good. I mean, I've never had any doctor say to me, oh, your vitamin D is really low, but that's typical for this area. And there's never been a follow-up, not once, not once. I'm like, wouldn't you like to know if it went up? I would like to know if the vitamins are working. Okay.
No, you're fine.
Because we're just going with it's normal and it's fine. Yeah. So this is a big one, right? Because we're definitely not saying, don't go to other doctors, right? So I would like for you to tell everybody, do you refer to other specialists? And does someone still need to have a primary care doctor?
Yeah, so that's a good question too. And I definitely, as I said earlier, I'm not like so exclusive that you can only see me and no one else, because I'm a fan of you building a team of providers, because we all have different specialties. So building a team that you trust, and I often do refer my patients in Minnesota to primary care doctors, acupuncturists. For women, I think having a gynecologist or someone to do your annual exams is really important, or every few years. Massage therapists, mental health counselors, and all other professionals. So I definitely refer to other people, because I'm not able to just be an expert in everything, and we just want to have, the best care possible. So I definitely refer. And I just love the collaborative care model. And so yeah, that's my piece on that. But another reason to keep your primary is, so this touches on the question about insurance, because another complicated thing about naturopathic practice is that it varies in every state. So like in New York, for example, naturopaths don't have a regulatory board yet, so we're not covered by insurance. And the same thing in Minnesota. We're registered through the medical board, so we have a governing board, but we're still not covered by insurance. So it really depends on your state. Like previously I worked in Vermont, and they have amazing scope of practice for NDs. And we were able to take Medicaid, and insurance actually did pay for regular visits, which is incredible. So there's a lot of states that are, really progressive in that way. And unfortunately, it's just taking a while, but I'm really hoping that that's something in the future that will be available. So that's another reason that I do refer to your primary. So like, if we just want to get some of the basics covered, like see if they'll do your vitamin D and like a basic thyroid panel, cholesterol, a couple other things, and then at least that much is covered by insurance and you have your annual physical. But another reason to keep your primary is because while I also don't offer acute visits, and I can't order imaging in Minnesota. I can't prescribe meds, and like I'm not anti-medication. I think there's a time and a place for everything if that's needed. So if there's a prescription that's needed, even for short term, unfortunately, I can't provide that. So I would need to refer for that. But also, my training is very much taught me to know the difference between what can be treated naturally and what just needs further evaluation. So I'm often working with other providers just to make sure that we're not missing anything. So that's, yeah, I think that sums it up.
Yeah. So also we're talking about with insurance coverage. So with the, if you can't work with the naturopath, right? As Dr. Pellegrino was stating before, that she can at least recommend her patients to go get their physical and then get some basic labs covered, but also, provide the next step, like what's the next advice for it, and then go further in that way. So there are ways of doing this, even though an ND is not covered in New York. I have still used that type of service, and I'm always, calling my friend over here and figuring out what else we need to do. So don't be discouraged. Just remember that the more that people are looking for this type of healing, you can play a role in this as well, of getting it covered. So think of it that way. So
yeah, and the other thing sorry, what was that last thing?
I just said, don't lay back and wait. Wait for
Yeah,
change.
exactly. Don't wait. I wanted to mention another option in New York that I think you, Vanessa, have tried, and I've recommended to some other friends, is there might be some naturopathic doctors who work within the office of an MD or a nurse practitioner, and then that allows them to basically have more coverage. And there's like kind of like ways to get around it. And there's a lot of NDs in Connecticut, for example, so it might vary just a little bit. And now that since the pandemic, a lot of NDs are doing virtual care. So, kind of opens things up a little bit. So I would definitely just do some research in your area. And I think, yeah, it's possible to find that coverage.
Yep. And we're going to talk about how, even though Dr. Pellegrino's in Minnesota, how she can help you from out of state as well. So don't worry, just hang on. So we were discussing how prevention's optimal, right? And your training has equipped you with so many tools for discovering the root cause and treating symptoms naturally. I think it's time to tell the folks at home what we have coming up.
Yeah, so I'm really excited to share that I'll be offering a live 4-week class on how to balance your hormones naturally and just, optimizing your overall health in general. The exact dates and times of that are to be determined, but we're thinking February, because just allow you to, come down from the holidays and the new year a little bit and kind of like, get into the new year. And then we'll get going on some, just optimizing your health. But it's designed to be interactive. So there'll be some kind of like journaling and meditation exercises and just questions. And you'll have the opportunity to ask me questions on maybe your specific concerns and just get some clarification on, things specific to you. And I think that part of the reason I'm putting this together is because so many people just need extra support right now and with optimizing health. So I do want to be able to help all of you who don't have an ND to work with yet. And there's really never been a better time to optimize your health with everything going on with the pandemic. So the more we focus in on self-care and just living a healthy lifestyle, it makes you more resilient to all of those external stressors like we've all faced in the past almost 2 years.
Yeah.
So the course it will give you kind of like a sneak peek into what it would be like to work with an ND, while also giving you a lot of health tips, just health tips galore, to get you started on your plan and feeling your best in the new year. And we'll talk about, it's set up to be kind of like the same pillars that I go through with each of my patients, like evaluating, some of those things that maybe you're taking in that are not great for you. So like adding more good things, taking away some of the things that are just making you not feel well. And then it will also have a specific focus on helping those within the category of people having hormonal symptoms. So that includes some of the symptoms I talked about earlier, like acne, hair loss, hot flashes, period symptoms like pain and cramping, irregular cycles, as well as fertility challenges, weight gain, sleep issues, and a lot more. And even if you're unsure about whether any of that applies to you, or if your symptoms are hormonal, because by the way, this is for men and women, either way, we'll be talking about those pillars of health. And I promise that as long as you're investing in your health, you're going to get so much out of it.
Yeah.
So stay tuned for more information about that. And we'll definitely post the exact dates and times as it gets closer, and we'll have a sign up sheet and all that.
Sign up sheet, virtual sign up sheet, exactly.
Yeah, but I would love to see all of you in the class, and I just think it'll be a lot of fun.
So I want you all to think about as well, like what Dr. Pellegrino is going to be offering, and I'm so glad that I get to come along for the ride, is something that you would pay a lot of money out of pocket for this type of education with an ND, guiding you. So just be aware of that. So when we post these workshops, I want you to take into consideration as if you're getting like educated from your doctor one-on-one in a sense, because it's way more than you would normally get. Okay, so we're providing something for the greater good of all, so that you're not coming like uneducated or not sure about things, and then you'll have the opportunity to ask her some one-on-one questions as well. So instead of having your first session with your ND and going like, I don't know anything, please teach me everything, you'll go kind of armed. And in that sense, you won't be starting from little, you'll be starting from like at least moderate, and then you'll be able to go further with your actual sessions.
Exactly.
So, when I go to a functional medicine doctor or a naturopath and they hear about where I'm at, I'm not starting at the beginning. So I get a way more than anybody else would. And that's been really, really helpful in my life. So the other thing I want to just touch upon is that it sounds overwhelming in a sense when you think of somebody only focusing on you or like giving you dietary, lifestyle, all this other stuff, this type of attention. Some people may say it sounds great, and other people may go, oh my God, I don't want somebody looking at my food log, or that I'm sedentary, or that I eat late at night. That's me, I eat late at night. Or that I'm sleeping like crap. I also do that sometimes. They don't want to be under that microscope, so they're nervous about judgment. And I want you to understand that holistic healthcare practitioners, at least the ones that I hang out with, we're on your side. We're here to help you become the most beautiful version of yourself possible. And we're not going to sit there and go, wow, you're doing horribly. This is just not going to work out for you. No, we want you to be truthful and transparent and be honest. That's why I always joke, like, I'm human too, and these are my issues, and this is what I have to deal with, and this is part of my struggle. And then I kind of am able to regroup, and with people like Dr. Pellegrino on my side, I can say, hey, I'm having a really hard time with this. Can you help me get to that other part where I have that passion again, where I have that want to, get on the bike or whatever, because I'm losing it. So we need people to do that in our lives. And this is the type of opportunity that you're not going to come across all the time, unless a lot of money. So just be aware.
And that's just, I mean, you said it perfectly. I couldn't have said it better myself, because it's not about, I'm all about meeting you where you are. So there's no judgment, you know, we're more like partners in wellness. So I'm not on some, you know, mountaintop, like saying that I'm so amazing. Like I love coffee and sugar, and I'm pretty transparent about these things with my patients. So it's all about being realistic and making realistic, lasting changes. So we work with where you are and how to get you to the point of, you know, your goals. So yeah, very sustainable and reasonable. And also, I don't think everyone needs to cut out gluten. But there is a lot of fear when people come in like, oh my God, you're going to take away everything.
That is a real fear.
Right. But it's not,
Yeah.
it's not necessarily true.
It's also great because I think when you have somebody who's actually going to provide the full thing, not just go cut out all this stuff, you know, I'll speak for myself, but I know Dr. Pellegrino does this too, where we're just not just like cut it out. Like, no, here are the other things you're going to substitute it with, or you're going to do this with, because we don't want you just kind of like feeling like, oh my God, that just cut out all my food. What am I going to eat?
There's no food to eat.
There's no food to eat. So that's not what will happen. And I just wanted to address that because I know even for myself, like I've been in that position where I wasn't provided any tools and I had to go out and figure it out on my own. And that just, it's failure, like out of the, right out of the gate. So that's not going to happen. And we're going to take you through some amazing workshop stuff. And that's all going to be posted really, really soon. But in the meanwhile, if you haven't seen our health tips of the week, ladies and gents, we have, I think, well, one will be posting this Wednesday. So we have 2 already posted. I just have to add one of them to YouTube, I think. But they're on Facebook on both of our sites. Hers is SoulSeed Wellness. That's the one on Facebook. On Instagram, she's Dr. Natalia Pellegrino. I'm Vanessa M. Meyer, LLC, in both. So share away, because this is too much for you to say to other people. You might as well force them to watch something. And we'll talk to you all soon. I don't see any pressing questions right now. If anybody has something they want to chat more about, feel free to inbox me or Dr. Pellegrino, and we'll get to you. All right. Be well, my friends.
Be well, everyone. Thanks for coming, and we'll see you soon.
Bye.
Bye.